Israel's COVID vaccination effort is leaps and bounds ahead of any other country. So is this the light at the end of the tunnel? Top Israeli COVID advisor, Professor Balicer, joins us today. I'm Michael Dixon in Israel, and this is Stand With Us TV Live. Hello and welcome to Stand With Us TV Live. Thank you for joining us. Coming up, I'll be joined by the chairman of the National Advisory Team of Experts that is counseling the Israeli government response on their COVID-19 vaccination rollout. But just before that, we want to tell you about our upcoming Stand With Us International Conference, Israel in Focus. It's taking place next weekend, and the conference is all about the mission of Stand With Us, fighting anti-Semitism and educating about Israel. We'll be joined by an array of speakers, including Natan Sharansky, Professor Gil Troy, Deputy Mayor of Jerusalem, Fleur Hassan Nahum, a panel from the UAE and Bahrain, Stand With Us CEO Rose Rothstein, and more. It's happening next Saturday and Sunday, next Saturday night, I should say, and Sunday. See the link for more details on our website at standwithus.com and book your place. And don't forget, if you love the work that Stand With Us does and you want to support it, you can do so at standwithus.com/donate. Now, Israel's speedy vaccination effort has seen the Jewish state hit the headlines, and for all the right reasons. Let's take a look.
Is underway with an important milestone just reached in one country.
Israel.
Well, Israel is moving ahead with its vaccination campaign. More than 1 million people there have already been vaccinated, putting the nation in the lead in vaccination doses per 100 people.
At the front of the pack, where 12% of the population already received their first dose.
Israel quickly rolled out its vaccination campaign with more than 250,000 Israelis vaccinated in the first week.
Israel is leading the world in vaccinations.
Thousands of people have streamed through what is one of the city's biggest makeshift vaccination centres.
I don't think there's anywhere in the world who's managed to do this, and to vaccinate them within 6 weeks is unprecedented.
Impressive stuff, and those numbers have only gone up since that video went out on Stand With Us social media. My guest today is critical to the country's vaccination campaign. He serves as Chief Innovation Officer for Clalit, that's Israel's largest healthcare organization, and he's founding director of Clalit Research Institute, the World Health Organization collaborating center on non-communicable disease research, prevention, and control. Joining us live from Tel Aviv, it's my pleasure to welcome Chairman of the Israeli COVID-19 Advisory Team of Experts to the government, Professor Balicer. Professor Balicer, thank you so much for being with us today.
Good evening, Michael. It's a pleasure to be here.
So first of all, thank you for the life-saving work that you do, and we extend our deepest appreciation to the healthcare workers and scientists and first responders across Israel and all around the world who are working around the clock. We have so much to talk about, Professor. We're 5 weeks out, I believe, since Israel's vaccination effort began. How many Israelis have been inoculated so far?
So by now, we've seen over 2.5 million individuals being vaccinated. And that is a tremendous achievement. We've seen, I think most interestingly, above the age of 60, we've seen over 80%. About 80% of the elderly above the age of 60 have been already vaccinated. And when we talk about the age group of 70 to 80, we're talking closer to 90%. So this is where we're standing right now. And the vaccination campaign is rolling as fast as we can. We've actually hit a couple of days ago a record of over 220,000 vaccinated people in a single day. And that's the most we've done until now. Approximately 2/3 of that is the second dose of those people that got vaccinated 3 weeks ago. And about 1/3 of it is new people getting vaccinated now and enrolling. And this is where we are right now.
And Israel is mainly using the Pfizer-BioNTech vaccine right now. So how many people have had the second dose already?
So we're getting close to, slowly getting close to about 900,000 people already getting the second dose, and the numbers are increasing on a daily basis.
And in terms of age range, you mentioned the elderly, largely vaccinated. That includes people in care homes. What other criteria are being used right now? Where are we at right now in terms of who is eligible for that vaccination?
So we've started our vaccination campaign with a clear focus on those aged 60 and above and healthcare workers. That were the first few weeks of the vaccination campaign, because obviously these are the people who are most vulnerable for the complications of COVID-19. After we have seen that we are hitting the mark in that specific group, we started opening up for additional groups. We at some point looked at teachers, and we now allow school teachers to come in and get vaccinated. We then reduced the age below 60 to those 50 to 60-year-olds. And by the time we saw we actually are hitting the mark in that population as well, we actually allowed people to go 40 and above. And this is the case right now. The most interesting thing that happened in the last 2 days is that we have added our high school kids above the age of 16. So 16 to 18-year-olds are actually invited. And it's beautiful to see they're coming into the vaccination clinics with their parents and getting vaccinated. This has started actually this Saturday, so just yesterday, and we already see a very good willingness to come and get the vaccine. I will say that even in the group of 50 to 60 years old that were not in the original focus group, we only added them in the last 2 weeks or 3 weeks. We have already reached 57% of that age group that has been vaccinated, and this is pretty good.
It's incredible. And pregnant women are now being encouraged to take the vaccination as well. Am I right?
Yes, we have opened vaccination for pregnant women as well as part of the effort.
I'm inviting our viewers to send us their comments and questions in the comments below on Facebook and on YouTube. You can also tell us where you're viewing from. We'd love to hear from you. Now, I think we can just look at a quick graph on the screen to show the top 17 countries in terms of vaccination doses per 100 people. So if we have a look at that, we see Israel is far out on front, followed by its Abraham Accords peace partners in the top 5, the UAE, the UK, then Bahrain and the USA. The question I have for you, Professor Balicer, is the speed of the Israeli effort has been second to none globally. So what is it that enabled Israel to move so quickly?
So I think there's quite a few characteristics and attributes of Israel that make this both possible and made it happen. I think the first point we have to take into account is the fact that Israel is a small country, overall less than 9 million people. And so getting the risk groups vaccinated, for instance, which are less than 2 million people, that's a very small dent in the international supply chain overall. So this is point number one, the size. Besides the fact that Israel is a fairly small country, so all of the efforts are fairly concentrated. You don't have to go long distances like in some much larger countries. So logistically, that makes things a little bit easier to be able to do in terms of logistic. The third point that I think that's worthwhile mentioning is that Israel has universal healthcare. Every citizen is covered with full health coverage from birth to grave, basically. And all of the care is being provided by 4 health organizations, the sick funds, that are really strong, integrated, logistically sound organizations that have a lot of experience and a lot of sheer power in terms of health workforce that can be mobilized in order to make such a thing happen. Another attribute that I think is worthwhile mentioning is that Israel is not foreign to emergencies. And so the need to move from such a mundane daily work towards all hands on deck situation is not something that we've never seen before. And so when the whistle blows and the need comes in, people know how to get everything mobilized in order to get the operations into gear. I will mention several additional things that help. All of our healthcare system is fully digitized. There's been electronic health records for over 20 years. All the data is centralized, and much of the health provision is of digital health, and telemedicine is something that is happening through all of the 4 sick funds. And so when we had the need, in order to identify our population that we want to focus on, in order to reach the outreach to them, in order to let them know that where they can get vaccinated, it was easily done. When a patient comes into the vaccination clinic, there's a very simple, easy way of registering, and all of the data flows into the central data warehouse. And so we have basically a real-time online assessment of how many people we've reached, who we have and who we haven't, where we need to focus our attention. And I think that's worth mentioning. Also, the one last thing, two more things that I'll mention. One is that we have a tradition of doing outreach as sick funds. The sick funds are very much community-based. Every physician knows very well the patients he's responsible for. And so people know how to access their physicians know how to get in touch with their patients. And we have our call centers that took part in this. And for instance, we had the call centers have real-time calls to the elderly people that were not be able to use the app, so they can come in. And the apps were pretty simple to use and schedule the vaccination schedule. The one last thing that I'll mention is the issue of how we have confronted the problem of the infodemic, the deluge of fake news and vaccine hesitancy encouragement that takes place in social media. But not only, we've seen, for instance, in the ultra-Orthodox groups, we've seen actually people putting posters on the walls in the ultra-Orthodox cities, warning them, don't take the vaccine, it's dangerous for you, it will make you sterile, it will hurt you. And so we had a lot of this false fake news to deal with. And the approach that we've taken on this has several attributes, I think, that were successful. One, we told things as they are. When we knew the answer to a question, we said, this is what science tells us. When we didn't know, we say we don't know. The evidence is missing, data hasn't come in yet, the clinical trials are limited, we don't know. So I think the public was already used to trusting the messages they got because we said things as they are. Point number one, transparency. The second point is that we had a lot of cultural adaptation of the messages in different languages to different subgroups, in different ways of communication, social media to some, street signs to other, evening news, TV commercials to some others. I myself actually went to an ultra-Orthodox congregation where one of the most influential rabbinical figures is having a class for ultra-Orthodox physician every week. And I went there, and for 2.5 hours, they fried me on the grill with excellent, scientifically sound questions about the Pfizer trial and the New England Journal of Medicine publication. They knew all the data in every appendix, and they asked every single bit of question. And 2.5 hours later, the head, the rabbi that had that lesson said, okay, I've heard enough. And within a week, he gave like a rabbinical verdict or an order that said, this is safe, this is effective. Everybody who can, go ahead, get vaccinated. And, you know, the fact that the prime minister and the president and us, we all took the vaccine on the first day on live TV, helped to alleviate some of the fears of the public, hence the high willingness to come in and get vaccinated.
Yeah, and we say that Israel is a melting pot, it's certainly a tapestry. And we have, you know, people from all different communities. So you mentioned the Orthodox community, also the Arab community. You happy with the take-up of the vaccine there as well?
You know, some communities are lagging after others. So at the beginning, the ultra-Orthodox community was a little slow, and by now, in the last week or two, we see a really quick ramp up, and they're getting there. The Arab members of Clalit, for instance, have by now gone above 50% for the 60 plus, and they're slowly catching up. But it does take a little more time in that population to persuade them to get the vaccination. And for, I mean, quite a few weeks, all of the stations in the key Arab towns and villages were actually empty. And so people from neighboring city came in to get vaccinated there because there were leftover vaccine there. I think actually the leftovers are an interesting story. Maybe it's worthwhile mentioning. One of the key things about this vaccination campaign is the logistical chain. You need to maintain cold chain, otherwise the vaccine is gone. So after you get the vaccine out of the fridge, you have to use it within a certain amount of time, days, since it's unfridged. And when you take it out, you have a few hours. So when time comes and you need to use or lose the vial, what happens is that people at the vaccination clinics tell everybody around, okay, this is free time. Anybody who wants the vaccine can come in and get it. And so if you are outside of the age groups, whatever, sometimes they said that they go outside, they say, hey, pizza guy, you want to come in, get a vaccine? They bring him in. But this type of agility has helped us to actually have very low rates of attrition. And we have destroyed less than 0.1% of the vaccines that we've given. So I think that's really important too.
So important to maintain those vaccinations. We have people watching from Mauritania, from Norway, from South Africa, from the UK, the US, including Cleveland, Kentucky, New York, Kentfield, Manchester in the UK, and Kansas. Many more besides joining us today. Do leave your comments and questions. We're with Professor Balicer today talking about the COVID-19 vaccination rollout. And Professor Balicer, the Prime Minister was, of course, the first to receive the vaccination live on air. He's promised that Israelis will be mostly, if not totally, inoculated by Passover, and that Israeli families, unlike last year, will be having their Passover seder together. Is Israel still on target for that goal?
So, it's a complex question. Let me try to dissect it to different parts. In terms of the logistics, yes, completely feasible. The HMOs are already vaccinated over 200,000 people per day. We can actually get even 1.5 times of that, more than 300,000 people per day if we need. And we can work 24/7. We got ready to do that, but there wasn't a need. But if there's enough vaccines, it can be done. So I think that in terms of the logistics, we can make it happen. It's a matter of how the supply, what is the rate in which the supply of vaccines would come in. That would be the first determinant that would say whether we can vaccinate vast majority of the population. That's really important. But the question about seder has additional, attributes to it. In order to have people grouping again in closed rooms beyond the vaccination, you need several things. One, you need to have enough time from the vaccines to have their full effect take place. So, in the vaccine trials, it was 7 days after the second dose in which the effectiveness was actually measured. So I think that's point number one. So we'll have to wait some time for all of the people that get vaccinated to be protected. The second point, which is still an open-ended question, is we know that the vaccine trials, we know the vaccine is very effective in protecting against a symptomatic illness. And we have some data to show that it's also effective against severe illness. But there's very little data to answer the question, how protected are we from infection and infecting others? And, one can get a local infection in the upper respiratory tract despite being vaccinated. And the rate in which this happens will determine a lot of how much of the vaccination campaign will cause an epidemiological barrier to the dissemination of the disease. The last point that I will mention that is really critical is the issue of the strains, the new strains and variants that we see, but we can talk about that separately.
Sure, and this is of course a global moment of need, and Israel is uniquely placed to help. So what can the world learn from the Israeli delivery of the vaccine, and of course these first real world examples of its effectiveness?
So in terms of the vaccine effectiveness, let me describe to you one of the first data analyses that we've already done and that we've released, and I'll describe it because there's a lot of misunderstanding about what the data includes. So I'll go to you step by step and explain what we can learn from that. And then we can talk about additional data that is coming in. So in terms of what we've done, about 12 days ago, we have released the first packet of data in which we looked at people, 200,000 people above the age of 60 that had the vaccine. And we have created a comparable matched control group of people that were not vaccinated, but were similar to them, also above the age of 60. And we compared the positivity rates of PCR testing. That's the test you do for COVID-19. And, those tests are being done both in Israel for symptomatic disease as well as asymptomatic disease. We didn't do an active testing. It's just a passive testing that anyone who had been sick and got the test, or who has been exposed to a patient and got tested. And so the PCR, what we saw was the following. In the 200,000 people that received the vaccine, rates were pretty much constant. The positivity rates were pretty much constant until day 14 after the vaccine. And at day 14 after the vaccine, we saw a sudden decline in the positivity level that has gone down. At that point in time, we had a fairly short follow-up. I think most of the people that were involved in that were about 14 to 17 days of follow-up, because again, this was 14 days ago, almost 14 days ago. And so on day 14 to 17 approximately, we saw a 33% decline in PCR positivity. So the control group kept on going straight, and the vaccine group had this dent that has shown a decline of 33% on average. And we thought that was very impressive to see in such an early phase, in those early days of 14 to 17, 18 after the vaccine. To see this decline was pretty impressive. And one would expect that as time elapses, then you would see more and more effect kicking in. And of course, once you have the second dose, then you will have the full effect that you could expect from a clinical trial, minus whatever happens when real world meets the vaccine, which is in many times different. You know, real world vaccination campaigns always have issues that are associated both in terms of cold chain maintenance that is never as ideal as the clinical trial. The patients are not as selected as they are in clinical trials, especially when we're focusing on the elderly. And so, and finally, it's also important to note that in that data that we've released, we looked at the 60-plus-year-olds. The Pfizer vaccines trials were looking at the entire age groups. So to summarize what we saw, on 60-plus age group, in an outcome that included PCR positivity, both symptomatic and asymptomatic, both of these modalities are different from the Pfizer vaccines. On days 14 to 17, approximately, we saw a 33% reduction in the positivity rates. And so that was very encouraging. You know, the vaccine seemed to work. Now, since then, 14 days have elapsed. A lot of data has been accumulated. You know, we vaccinated until now over 2.5 million people, many of which with the second dose. So we have quite a lot more data. And we have said, even then, 14 days ago, we will only release another packet of data as a published scientific manuscript with a proper, very careful methodology that would deliver the message so people cannot make any error in trying to interpret what it means. And we're getting there. We are working very intensively on the data. We're seeing some very specific trends. I will not go into what the results would show, but I think we see a very clear pattern, and I think a very clear response would stem out from the manuscript when it's out.
Well, it sounds like an optimistic response, certainly to the initial findings, and something that can really help the world. Israel is really a test case in this regard. You know, some media and activists can't praise Israel without defaming the country. And one accusation we've heard repeated is that Israel isn't helping the Palestinians with COVID-19 vaccinations. Now, to answer this question about whether Israel is expected to vaccinate the Palestinians who are in the Palestinian Authority and under Hamas in Gaza, Deputy Mayor of Jerusalem, Fleur Hassan-Nahum, actually did this incredibly well on a video that we'll show you right now. So take a look at this.
In the last few weeks, Israel has had to face ugly accusations about its vaccine program for its people and the Palestinians. So let's get the record straight. In the 90s, Israel signed peace accords with the Palestinian Authority called the Oslo Accords. In these accords, they became responsible for their own healthcare. This is what they wanted. They wanted autonomy. They wanted self-determination. And this was part of that process. If Israel would have gone into the Palestinian Authority territories to help them handle the COVID crisis or even roll out vaccines, it would have been seen as an infringement of their autonomy. So you can't win. On the one hand, if we don't get involved and we let them have their autonomy, we're abandoning and we're not fulfilling our obligations according to the Geneva Convention. What? And on the other hand, if we do, we're infringing on their autonomy. You can't, on the one hand, be an entity that takes aid from the entire world in order to manage your own people, and on the other hand, take those funds, pay terrorists, and not deal with a health crisis and have enough vaccines for your people? Which is it?
I wanted to just show our viewers that video because it's an important point, and unfortunately some people are using this issue to demonize Israel. With the Palestinian Authority has its own health ministry, it's legally responsible. Israel has vaccinated Palestinians in Eastern Jerusalem, and we're told the Palestinian Authority has procured vaccines, will be running their own rollout while also refusing Israeli help. So important to set the record straight. Professor, we deal with the mutation of anti-Semitism, which unfortunately is a virus that never goes away. You deal with, of course, the very real mutations that are happening right now. Let's talk about that for a moment. We have these variants coming out of the UK, South Africa, Brazil. Do we know if the vaccination helps inoculate against them?
Yeah, well, I'm not a politician. I'm staying away from politics as far as I can. But as a scientist, yes, indeed, the issue of variants is really interesting. So the B117 variant, which has originated in probably in the UK and has spread worldwide, is becoming the dominant strain here as well. According to our assessment, about 40% of the new infections are actually due to that specific strain. And we know that this strain, according to studies that have been done mainly in the UK have been hinting that this strain is more infectious than the strains we've seen before, up to 1.5 fold. And we fear that might be one of the reasons we're experiencing such a terrible wave of infection that has made it necessary for us to go through our third lockdown that is now on its third week. And so that is that strain. The other strain that has emerged originally in South Africa, which is slightly different than the one that originated in the UK. We've already seen 22 identified cases in Israel, so it has been already imported here. But we are not sure that it has already spread in a very significant way, and we're keeping our very close eye on this. In terms of the strain that came from Brazil, the P1, we have not yet identified it here in Israel. And so I think that's really important because until now, all of the evidence shows that the B117 strain, the one that is prevalent here, is sensitive to the vaccine. The vaccine should be as effective to the strain as it was for the original strain that we've seen before. So overall, it's not good because it is more infectious. The data that has been released by the UK in the last 2 days, that it might also be a little more virulent and there would be more severe illness caused by the B117 is something that worries us. And we're trying to see if we can corroborate this in our data. But definitely the fact that the vaccine should be effective to it is our main hope. If we will continue vaccinating in this space and we will get most of the population and vast majority of the population at risk covered, then I think that we might have this wave pass upon us without too grave detrimental impact.
Thank you. We have viewers joining us from Budapest in Hungary, from Tucson, Arizona, Phoenix, Arizona, Florida, Austin, Houston, Texas, Northern Ireland, Toronto in Canada, Montreal in Canada, Tel Aviv, Jerusalem, and Beersheba. So some Israeli viewers as well. I'm taking some questions from our audience. Tomer, who's in Miami, says, this is your expertise, Professor. What can we learn from previous pandemics about our way out of this one?
Well, it is difficult to draw conclusions. If we look at the flu pandemics, which I think are the most relevant comparators, then, we have two pandemics that happened in the middle of the previous century, but they were much, much more indolent than what we're seeing right now. And so it's difficult to take conclusion from that. When we take a look at the 1918 Spanish flu, now that had a much higher case fatality rate than we see right now. So that was a worse epidemic, and it raged in a time when the First World War was actually around. So it's really difficult to draw conclusions from how that started. It is true that even in that specific one, we did see a herald wave that happened in the spring and before a very bad winter wave has hit the entire world. So again, what we see right now is pretty similar. You know, at the end of the day, that specific strain became, after it raged through the entire population, there were no vaccines available at the time. You know, none of the technologies that is relevant now was then. At some point, it became a usual, mundane strain that the population got used to. But I think that here this will be slightly different. I think that where we're heading is to a protection by the vaccine. It will take time for enough vaccines to be manufactured for the whole world to be protected, or enough to create significant immunity and indirect protection. And at some point, additional mutants or variants might come up that would have some ability to escape the existing vaccines. And because the technology in which we create the mRNA vaccines is one that allows you to create a new vaccine fairly quickly and in the same technology, I suspect that at some point we will see recurrent vaccination campaigns with updated vaccines, a little bit similar to what we see with flu, in which every winter we provide a new flu vaccine that is updated in terms of the most largely circulating strain in order to prevent escape mutants.
Professor, you mentioned the fatality rate. Patricio in Mexico City is asking us, how did Israel keep its fatality rate so low? Obviously, everyone who has died is a terrible tragedy, but the death rate in Israel has been quite low compared with other countries.
Yeah, it has. And so there are several reasons to that. First of all, yes, it's true. We have to account for the fact that we've seen 4,000 people die, and this is a huge tragedy. And we always need to think about what could we have done and what we should be doing in order for that number not to be higher. But it is true that in terms of case fatality rates, it's one of the lowest ones in the world. And I see several reasons to this. One is the age structure of the Israeli, the age structure in Israel, which is lower. People here are younger than some of the European countries we compare ourselves to. So that's helpful in terms of case fatality rates. The second point that I think that we can mention is that because of the expertise in our local hospitals and the rapid adoption of new techniques of putting people with their face down very early on, when we saw this is helpful, when we stopped the intubations fairly early, we understood that we need to do everything in order to postpone mechanical ventilation as much as we can. And the early administration of steroids, once this became clear that it is helpful, I think it helped. The third point that I'll mention is because Israel has such a strong infrastructure of care in the community setting. So, pandemic is really a disease of the community setting, not of the hospitals. And vast majority of the patients are being treated by the community physicians, by the GPs and the nurses out there. And because we have such a strong community care network, I think that was very helpful to keep people at home and know which time is right in order to get them out into the hospitals. And they are followed at home with pulse oximeters and with ongoing monitoring of how they're doing. So that's really helpful. The last point that I'll mention is that we used, for instance, the Clalit data warehouse fairly early, even back in March, to create a predictive model, a predictive model for which patients are going to be most likely to have a severe disease if they contract COVID-19. And by mid-March, we had a predictive model that identified the patients at risk. We identified them through our electronic medical records repositories. We identified them, and our physicians and nurses called them one by one, all of them. All of the high-risk patients, both the elderly and the non-elderly, and told them, stay at home. If you need care, we'll come there, or we'll provide you digital telemedicine. But whatever you do, don't leave the house at this point when the disease is raging. And I think the rate of infection among the elderly and the most vulnerable has been kept low. And I think that was part of the reason why our case fatality rates were also kept lower than in some other places. Plus our, I think, very good way of testing. We have a lot of testing being done. Over 100,000 people get tested a day. So I think that's also worthwhile mentioning.
Excellent. Bernard and Batcha Liebman are in Atlanta, Georgia. They're asking, they're scheduled to get the second shot of the Pfizer vaccine this coming Thursday. Aside from immunity for us, will we still be able to transmit the disease like the many asymptomatic carriers we miss hugging our grandchildren?
Well, you know, this is a really important question, and I think it's still an open-ended one. We are doing everything that we can to analyze our data, and we also have an ongoing proactive study where we are recruiting people into an informed consent trial where we are following up on them on an active basis in order to answer this question. The results are not yet out, so it's very difficult for me to answer, but I would tell you this. At this point in time, when the disease is raging, at least in Israel, when the dissemination in the community is very high, and we still don't know what is the actual level of protection in real life after the 7 days after the second dose, I would wait. I would be careful. I would continue meeting the grandchildren, in the open air. It is really important to visit the family. It is really important for the grandchildren to see the grandparents. But until we know the answers to that, I would still keep the 2 meters distance. I would meet outside and not indoors. And I would continue to be careful and wear the masks until we have more clear answers about the level of protection that is actually conferred and the timing in which we can actually trust that the person is both immune and also its likelihood of infecting others.
Thank you. Dina is asking us from America. She's saying, if people have had coronavirus, should they be vaccinated?
So, they could get vaccinated. There's no problem with that. In Israel, we have decided that people that had the coronavirus and they have been found to be PCR positive, we tell them that they do not need to get vaccinated now. At this point, we are trying to prioritize our vaccines to those people who are naive, who have not yet had the disease. And actually, also, it's worthwhile mentioning that if a person got the first dose of the vaccine and between the first dose and the second dose, he got ill with COVID, we also recommend that they do not get the second dose. We save it for those people who need it more.
Josh is in Washington, D.C. He says he knows people who are hesitant to get vaccinated because they're worried about potential side effects down the line. In your experience, he asks, is there any historical merit to warrant such concerns regarding vaccines?
I would say that historically, the vast majority of the vaccination campaign have proved to be both safe and efficacious. And in some of the instances that vaccines have been drawn out of the market because of safety issues, for instance, for the rotavirus previous vaccine that was drawn out because of the risk of intussusception, that's a problem with the bowels. People have then later on did the calculation and saw that so many more kids have died because the vaccine was dropped out rather than if it would have continued. I would tell you this, we have to acknowledge the fact that these vaccines have been tested on a limited amount of people for a limited amount of time. So we can't know everything. And the theoretical risk always exists of something that we don't know. We don't know what we don't know. But there's something that we're pretty much sure about. And that's the fact that the disease itself, COVID-19, is a very vicious virus to get. And if you're within the vulnerable group, the rates of severe disease and severe complications are really significant. And if you're younger, there's a risk of what is called long COVID that is yet to be elucidated, but some preliminary studies already out show that a considerable proportion of the population who actually have it might suffer from prolonged symptoms. So, if you ask me what I'm more worried about myself, about my immediate family, is that about the theoretical threat of a yet unknown side effect that would be rare because we haven't seen it until now. Not in Israel, not in the 2.5 million people that get vaccinated until now. We didn't see any of these things. So should I worry about that or should I worry about the virus? I'm worried about the virus. I got vaccinated. I vaccinated my entire family, everybody who could, and I would strongly recommend anybody who's my friend to go and get vaccinated.
Michelle is in London. She says, from a medical standpoint, what happens if you take the first COVID vaccine shot and there's no vaccine for the second shot when the time comes to take it? What happens to the body, and where does that leave someone in the vaccination process?
So again, this is a really interesting and open-ended question. We still do not know what would be the expected effectiveness, real-world effectiveness of a single dose of the vaccine. And there's several questions that come to play when you have only one shot. One is, what would be the overall effectiveness without the proper boosting that was tested in the trials? So we know from the trial what would be the expected effectiveness in 21 days after the first dose, but we don't know what happens afterwards, because in the trial people got the second vaccine. So we don't know what would be the effectiveness beyond day 21. We do not know for how long this protection will be conferred. And we don't know if the level of protection, the amount of antibodies and the cellular immunity, etc., would be able to tackle the virus in different viral loads and in different strains. We do not know what would be the relative effectiveness in real life. So the answer to your question, the short answer is we don't know yet. We can have some estimates. We can hope that we will see something that is remotely similar to what we've seen in clinical trials. But I have to say that if I had to assess the likelihood of being able to replicate in real life in 90 or any closer to that, I've heard the numbers, 90% effectiveness against infection or against symptomatic disease by day 21, I find it from everything we've seen until now, it will be very difficult to get to those numbers with a single dose by day 21. What happens in day 28, in day 45, it's an even bigger mystery.
It's been an incredible rollout, of course, and we are rapidly running out of time. And as I expected, we had more questions than we are able to ask. Before we close, Professor Balicer, when you look back at this period, many years in the future, please God, the pandemic will be but a distant memory to all of us. What would be the strongest experiences that impacted you? What memories will you go to first of all?
First of all is, in 2007, we as a country wrote a preparedness plan for a pandemic. And I was at that time the editor of that pandemic preparedness. And I had a notion that, what we're planning for will happen. It's not a question of if, it's a question of when. Personally, I thought it would be a flu pandemic, but eventually it was a COVID, a coronavirus. And so when this whole thing started, for me, it felt like an unfolding of a story that at least partially, I felt like I already lived through it. Been to so many tabletop exercises that I think, it was a strong premonition that I said, I think I know what's about to happen. And at some point that stopped. And, suddenly you're in the complete mist, and it could unfold in so many different directions. And so the need to collect data in real time and to be able to provide inferences for decision makers, I think that is a tremendous experience. The decision-making process is so difficult with so many unknowns. And so I have to say that this is still a very tremendous experience to go through, to try and provide the right evidence at the right time to decision makers to make the right choices. I hope we're doing well.
Well, it certainly looks that way, and we certainly hope so as well. Of course, our thoughts are with all those who've suffered and lost loved ones during this time. In the meantime, Professor Balicer, thank you so much for making the time for us today. We know how busy you are, and thank you for the vital work that you and your colleagues do. We wish you every success imaginable. Let's hope for a real turnaround as this year continues to progress. Thank you very, very much.
Thank you, Michael, and thank you all, and I wish health to all of us.
Thank you. Amen. And now, just before you go, don't forget to join us next week for the virtual Stand With Us International Conference, Israel in Focus. You can register now via the link you see on the screen. And that's next weekend. And then Stand With Us TV Live will be back the following weekend after that, in 2 weeks, when we'll be joined by a statesman, historian, parliamentarian and former Israeli ambassador to the United States. That's Michael Oren. Lots to discuss with Ambassador Oren, so please join us then. We'll be live at this time every second Sunday. And if you missed any of today's interview or any of our previous shows, you can head to Stand With Us TV, where you'll find a host of great content, video content available at no cost all around the clock. Don't forget, if you love the work of Stand With Us and you want to support it, please go to standwithus.com/donate and do so. In the meantime, stay healthy. Thank you for standing with us, and shalom from Israel.